So you got a decision always. Pills or pain. In this life, you have to make a decision. For example, no, I don't mean just physical pain. I mean like mental pain, depression, anxiety, stress. Might be mourning a loved one. That's what I'm talking about. You're always going to have a choice, pills or pains. And I'm gonna give you a short example right quick. I've been having chest pains for like 10 years. So when I have a chest pain, I take a pill because I don't want to play with that. But I also got a bum knee from playing sports in high school. Every couple of months, it'll flare up and it'd be sore for a week. I take the pain on that one. So in life, you have to make a decision. So as parents, we have to educate our children, our teenagers, our young people that we love on pills or pain. And what I'm talking about, I'm going to break it down a little bit more. I have a daughter, and she come home crying because she just broke up with her high school boyfriend, her first love. She cried for a couple of days. Now, I feel sorry for her. I want to help her. So what did I do? If I have enough support, she had sisters or brothers to help support her. She has friends. She got an auntie. She may have a grandmother to look over her for a couple of days, make sure she's all right. She's not going to do nothing crazy. Talk to her, have her talk to me. See what's really going on. Try to get underneath the layer of the onion. Also, her mother might want to take her shopping to get her mind off. I need to assess her, see how it's going. She is in pain. And what do I do? Do we let her stay in the pain for a little while, get over it? Or we pick the pills, put on depression medication, give her a benzo so she can have a Xanax or Clonopin to help with the pain. What do? We put on Celexa, an antidepressant medication. We have to make this decision. As parents, we can't blame a doctor for making the decision. So every situation is going to be different, I know. But in this life, we have to get ready to make a decision for our loved ones. Which one do we want to approve? Her being heartbroken for a couple of weeks and have support around her, or take it straight to the mental hospital, put on some medication, try it out, see if it works. So in this life, you're the parent, we are the adults, so we have to be able to pick pill or pain, because our young teenagers not going to be able to make their decision for themselves. Do you know Clonopin and benzos can last a lifetime when you become physically dependent on it? Do you know depression medication, you may have to take it for a lifetime? Because the doctor is going to tell you that life always going to have its ups and downs. You're always going to be going through pain if you live this life. So pain is always going to be there. You're going to have your ups and downs. So sometimes you're going to be in pain in life. So do you stay on medication because you think there should not be no pain? If you take a loved one to get their teeth pulled and the doctor writes a prescription for Percocet, you have to be the one saying, no, sorry, doctor. Do you have any alternative medication? Percocet is known to have addictive personalities. We get out surgery. Oh, you describe narco. It's an opiate. Opiate have proven that it can ruin people's lives forever. And once you get hooked on the pills, you know what's going to happen? You become a slave to the pills. And the doctor become your slave master. Because if that doctor one day decide not to give it to you, what are you going to do? What if the doctor changes the medication? What are you going to do? What if the doctor passed away and then you had to get another doctor? You spend your whole life on this pill, hamster wheel. So sometimes you got to decide, should I let my kid teenager go through this temporary pain, or should I give my kid the pills? Now, we all know if the kid's doing something very animated, like jumping out the windows, cutting themselves, suicidal behavior, self-harming behavior, yeah, we know that's an emergency. We had to choose the pills because it's out of control. However, is the kid doing okay? Just to distress a little while, have anxiety, have normal up and downs, you may have to pick the pain. And let me tell you how it goes, okay? A child have a big life event. They go to a school counselor and they say, I had a big life event. I'm just feeling really depressed. I don't know what to do. The counselor called the mental hospital. Mental hospital, we're going to take the report. We're going to say the person made certain statements, so we got to bring them in for a evaluation, like 3 or 4 day evaluation. Then what's going to happen is the doctor going to talk to the parent. He's going to say, hey, what about your daughter? Does she normally like this? Yeah, she get like this time and time. Sometimes she is down. Sometimes she do. So she have a lot of anxiety. And she have stress over the test season. And the doctor may say, okay, let's try something. Let's try a small dose benzo 0 to 5 of Xanax. We'll give a very small dose of Klonopin, 0.5. It's very small dose. Let's see how she act on it. A couple of weeks later, oh, she's doing good with that. Then when it start working, her tolerance build up. She need a higher dose. Then a higher dose. Then start working, got to try something else. Because now she detoxing off this here. Why is she trying something else for a little while? Just got to be in the hospital again, talking to me, Mr. Steve. It might be a lifetime deal. So sometimes pain is necessary in life, but I'm not sure. If you have the right support system, then you might take the pain. I know it sounds bad or evil. What I'm saying is sometimes pain is better. And I'm pro pills because I just told you I take the pill for my heart hurt. Chest pains, I got to take the pill. And I'm telling you this crazy story. It's a true story. I had surgery in Japan. And because I'm a nurse, I'm a little particular about medications and procedures. I told them I didn't want a catheter because I don't want to risk the infection that catheters can bring. I told them I don't want to be on opiate when I get out either because I've seen what they do. It is what it is. I don't want this in my body. After I woke up from the surgery, I was in extreme pain. I was hurting. So they put me on the table. I was grimacing. I'm making noises because I'm hurting. I'm in serious pain. I'm sitting there, right? And I know why they didn't give me the medication because they don't want to suppress my breathing because opiates suppress respiratory function. And when my stomach started to wake up, my midsection, and the involuntary muscles started to move. Oh my God. I had no control of it, They moving, they waking up, they moving around inside of me, involuntary. And you don't feel your involuntary muscles normally unless your stomach growling or you have to go to the restroom. So I asked the nurse for a Tylenol IV. I said, hey, yeah, give me Tylenol IV because I was hooked up to IVs in a way. I took that, right? And finally I fell asleep because I was in a lot of pain. I woke up the next day and they offered again. I said, no, I'm good. And they said, yeah, but we can see you're in pain. You're grimacing, you're in a lot of pain. We know because you just had surgery. Surgery cut you open, so you're going to be in pain. I said, no, I'm going to deal with it. So I did my screaming, whatever. Walked to my room because in Japan it's different. They make you walk to your room after surgery. Just a different system. Then I got on the bed and I just dealt with it. I was pain got a little better at a time. And the reason why I took the pain was because I'm a nurse. I wanted to know was I'm getting better. And I didn't want to take a lot of medication to mask the pain. So if I'm in no pain, I don't know if the surgery went well or it didn't go well. So the next day, I was in half the pain. I was, I'm in half the pain. I can go to the restroom in pain, but when I'm sitting down in a chair, I'm good. The next day, the pain would cut in that half again. So I can walk around the unit now. Yes, I'm in pain, but I still can do it. The next day, lesser pain. And I was about to discharge, and I refused all the pain medication. And my wife got really mad at me. She said, Steve, they gonna think black people doesn't feel pain. You had surgery, you had this IV of Tylenol drip, and you're gonna be discharging soon. Why are you lying about your pain? I said, well, I want to go home, number one. Number two, I wanted to know if I was getting better. I was paranoid. I wanted to know, is the pain going away? It means I'm getting better. So I'm not talking just to talk. I did it. And yes, the first couple of days was hell. But after that, it was nothing, because compared to the first day, it was nothing. But here's why I did it. Because I know a guy who was CEO of his own company, had a car wreck, got on narco, got addicted to narco, lost his wife, kids, his family, and his company. And he's always cycling in the mental hospital because it's the only way he can get narco. Now, I knew he's highly intelligent because when he assists everybody, when he talk, he think before he talk. And he was a really intelligent person. You can just tell. I had those experiences before I had the surgery. So when your kid or loved one have toothache, they had to get their teeth pulled, the doctor write Percocet, you got a right to say no. You got a right to say no. Don't put them on that. Again, it's not medical advice for information purposes only. But what I'm saying is you have the option. You got to stop blaming the world, blaming all the doctors for what they do. You have to tell yourself, son, you're going to be hurting in a couple of days. We're going to give you less pain medication, not as strong as that, not as habit forming, not as addictive. You have to be able to tell your loved ones, hey, you got a lot of anxiety right there. We have to have some alternative for your anxiety. We don't need to put you on stuff that's going to make you physically dependent. We don't want you to be slave for life because you took the down pill. Now, I'm pro-pill because I've seen pills save people's life. Medicine is amazing. I'm not saying this against medicine. I'm a nurse, which is a legalized drug dealer. The doctor write it, I follow the orders, I give it. I give education on it. I don't take it personal. My thing is I want the patient to get well. Here, I'm just trying to educate people that they have other choices. They are in control of their health care, not the doctors. You are in control. When my kids get adults, which all my kids are adults, I got one in 17. He's a healthy freak. He watch everything he put in his body. He's athlete, so he don't eat nothing sugary. He even look on my shoulder if I'm cooking something, make sure the ingredients are right, or I'm using the right oil. You, as the parent, have to be in charge of your loved one. When they get adults, they can do what they want to do. But you don't want to make them a slave to the pills. So sometimes you always got to ask the situation, okay, I got this situation. Which one I pick? The pain or the pills? That's all this video is about. I'm just trying to give you other options because life is going to be life, and life is hard. It's never going to stop. Never going to stop. And in those dark periods, which medication was designed for a short period, but it turns a long period because nobody have a cutoff date because life going to keep lifing. So you can keep taking pills. But pills is made for short-term use, not life. So I'm just saying is, stop complaining about the doctors. You got the power. You're an educated person. You're intelligent. You might be physically dependent on the medication yourself. If you know what you're going to do, waking up, shaking, aching every day, then you should tell your loved ones and teach your children, yeah, I'm addicted to this, but you can't have this. You don't want to go to the emergency room and you have all these allergies or these pain medicines because you've been addicted to all kind of pain medicines. Then your body resists it. Now you want this particular medicine and the doctor refused to give it to you. Now you're just suffering. So I'm in this video like this. Whenever you have a decision, and stressors, and anxieties, depressions, you have to make a decision. Pill or pain. If you have resources, people to talk to, go seek therapy. You have family members, grandmothers, and people that can support you or your child, then you can deal with the pain for a short term because you have support systems. Some people don't have support systems. They're the only child, a single parent. I'm not talking about them. They have to do what they have to do to survive. But if your loved one doing something really reckless, dangerous, self-harming to themselves and others, then they have to be taken care of with extreme measures because you're trying to save their life. And I'm going to wrap it up this here because I got another crazy story. My son was always a little boyish, always irritating, right? So his teacher one time called me and said, hey, I think your son got ADHD. And I was a nurse. I was like, excuse me, are you a healthcare professional? She was like, no. I said, okay, you should stay in your lane because I am. I hung up. And that was the end of that conversation. Did he get on my nerves, go to a room and flicking on light switch, hotel rooms, mess with the light switches. I always want to see what works, try to take apart the stuff. Sometimes he broke stuff. Was he always high energy? Yes, he was high energy. But that was the pain I was getting from him. Him just being him, always into stuff. But I took that pain. Yes, he might could have did better at ADHD drills or Adderall. But he was already doing good in school anyway. He could have done better with stemming it. But he was already functioning. He had friends. He wasn't getting in trouble. And he was doing okay in school. So we took the pain of him being him. I didn't pick the pills because the pills could be a lifetime deal. Even though he might have did a little better in school, a little more focused, but he also could have been a zombie too. So I was a parent. I had to do what I had to do. I chose the pain over Adderall. Why? Because I don't personally believe that you should slow people down. If God made you active, then I think that's when God made you active. Again, in extreme cases, I'm not talking about bad about Adderall. Some people need it. What I'm saying is, if a loved one is functioning and doing okay in school, they got friends, they're not doing dangerous behavior, you have the right to choose the pain over the pills. That's all I'm saying. I'm pro medication. This is only educational advice. I'm a nurse for a lot of years. I'm just trying to tell people they have a choice, pain or pills. Pills in extreme cases in short-term use. Pain if you don't want to be addicted or slave to the pills. That's about it, guys.